You know that unpleasant, burning, burpy feeling you get after eating a heavy meal or drinking too much coffee? That's acid reflux, technically known as gastroesophageal reflux. For most adults, reflux is a lifestyle problem. But reflux is different in infants and babies. For them, it's usually not an acid problem. Instead, reflux usually occurs when a baby's lower esophageal sphincter, or LES, relaxes. This ring of muscle contracts to keep stomach contents where they belong, in the stomach. It's normal for the LES to relax sometimes, but it happens more often in babies. The good news? Most babies will outgrow reflux by age 1 as their LES gets stronger. Babies have different symptoms of reflux too. They tend to spit up after feedings, arch their back often, and act fussy around mealtime. Fortunately, if your child is growing well and not developing other problems, such as breathing difficulties, treatment probably isn't necessary. But what about medication? Doctors used to prescribe medications like antacids and acid blockers to treat reflux in babies, but now we know that acid isn't the problem in most infants with reflux, and these drugs don't seem to help with most symptoms. If your doctor recommends these kind of medications, you may want to talk about other options. One non-drug option is to change the way you feed your baby. A health professional can show you how to position your baby to lower the chances of reflux. Thickened liquids may help too. This is formula that contains rice cereal or oatmeal, or breast milk that contains commercial thickener. The heavier you make a liquid, the more likely it is to stay in your baby's stomach. And that means reflux is less likely to happen. A nutritionist, feeding specialist, or gastroenterologist can tell you more about thickened liquids. Have questions about reflux? The experts in Boston Children's Aerodigestive Center can get you answers.